Myofascial pain syndrome is a soft tissue pain syndrome, so it's originated from the soft tissues, and the term is related. The term, the old term is the TRPS, the term of the muscular rheumatism. Oh, it's old term. To the newer term, soft tissue pain syndrome, which can be abbreviated as SATP, is also relevant. So, in the SATP, we include bursitis, subacromial or cranotrochanteric, prepatellar, presancerine, tenosynovitis like the biceps, supraspinatus, and Achilles, and so on, and entesopathis. Yes, so one more time. Bursitis, so inflammation of the bursas. Tenosynovitis, so of the tendons on the synovium, and entesopathis. So entesopathis are the pain on the insertion of the tendons on the bones. And regional STP includes myofascial pain syndrome. What is the myofascial pain syndrome? And MPS is involving muscles of the trunk and extremities, so generally all. And we also have some different area of the body. Yes, we have one more area of the body, that is the face. Yes, so we have also the MPS involving the facial muscles. We also have something called complex regional pain syndrome of type 1 and type 2. In case of the generalized STP, so if we have those signs and symptoms generally everywhere in the body, we think about fibromyalgia. And related to the fibromyalgia is the chronic fatigue syndrome. Sometimes the generalized pain, so the pain that is nearly everywhere, is also related to the hypermobility syndromes. So when we have some hypermobility, we have the pathological mobility. So we have the mobility that we should not have. Hence, we may have a pain related to this pathological mobility. Okay. So these are generally areas that are painful in the area of the skeletal muscles. Yes, so we can have taut bands that can be exquisitely sensitive to the pressure. Yes, so when we touch, we feel those hard bands, and they may be very painful. Okay, and sometimes they are not very. Sometimes they are not very painful. Yes, sometimes they are present but not very painful. And they may occur of other pain generations. Yes, so it can coexist with or is secondary to other acute or chronic painful muscular condition. Yes, so we can have first some other muscular conditions, and then we get this. Yes. So, for example, we can have temporomandibular disorders, cervical degenerative disease. So things about what we were already talking about earlier. Cervicogenic and chronic tension type headache, thoracolumbar back pain, yes, so generally some pathologies of the vertebral column, some pelvic pain, upper or lower extremity pain, and so on. And this may lead to secondary problems. And what is the prevalence? Generally, there is no good data about this. But so the MPS ranges from the 20 to 95% of patients presenting musculoskeletal pain. So it depends on definition, it depends on a lot of things. So it's hard to tell about the prevalence exactly. Thank you.